Today we have Dr. Raj Brahmabhat himself. Thank you so much, sir. He is a renowned sexologist, has been practicing for more than
2 years, 42
42
years.
years.
1980 I started.
42 years, and he's still as young and as energetic and as chirpy, I would say, as a 24 years old. So thank you so much, sir, for giving that energy in throughout the conference and right now as well. So, sir, a few basic questions for people who are
So
actually.
before you start, let me say,
Sure.
42 years back, to think to jump into a sexual medicine, which never existed, to be honest with
True.
you. And in no medical college till today they teach about sexuality and sexual education. Lisa West says, even if that is being caught, it was considered as it's a pornographic and you can be behind the bar. And leave aside other people. Near family people said, दूसरा कोई धंधा नहीं मिला तो इसमें क्या है?
I can
And
completely
today
understand.
it was a very difficult task because I am just a basic. Started my practice career as a family physician, reached to the top. I was an international this thing, and then I jumped into this
But, sir, just a small question. What made you choose sexual medicine?
because some of my patients, who came and I had no answer, like Alfred Kinsey, who did a pioneering work on a male and a female, behavioral therapy. The male Kinsey's male volume and female volume, it is known as. So they came to me and it was never taught to us about sexual thing. So I said, all digestive system, respiratory system, even reproductive system, but nothing about sex. So one of the meeting, it happened in 1980. I was invited to speak because I was doing a family practice to start and go on speak on the subject of sexual problem in family practice. And believe me, it was so difficult to discuss those things. And when I asked about the masturbation, Hastamaitun, nobody said, and one lady doctor, she said, one of my patients, she is masturbating. That was a big taboo.
Wow.
You can't use other words, that was another problem over there. And then I said what to do. So after that presentation which I did, which was very well accepted, and then I was thinking to be or not to be or not to be, like that. Then I was invited to talk on 1983 Asian Conference,
Okay.
and they just asked me what you will speak, And I have an art and science both, combination. So I said, I would like to speak on the subject of Kama Sutra.
Wow.
And believe me, till that day I had never touched a Kama Sutra because they were wrapped in the yellow cellophane paper and they were considered as a yellow book. So I got down and I got the first time a book on Kama Sutra. And not only Kama Sutra, but Geet Govind I presented and Khajuraho Symphony in Soul,
Wow.
and which was at Germany. So from that time, everything went so smooth. And then I was invited to present that how sexuality and art is seen in our country. So right from the Vedic period till the Britishers left this country, how sex was seen in paintings,
Ji.
sculptures, day-to-day objects, and manuscript.
Ji.
And fortunately, I had gone and studied iconography, means what god, goddesses, what are those statues are there, sculptures are there. Then paintings also, like Rajput painting, Mughal painting, Basoli painting, Kangra painting, Deccan painting, all those things I went and studied. Jaipur painting, even Rajasthan miniatures. One of the most beautiful things you'll find in two places, Rajasthan and in Karnataka.
Karnataka.
They have got a lot of things about sexuality. And all those things I presented first time, erotic art exhibition erotica. First was done in Norway, Sweden, with the people's money.
Wow.
And this was in Taj Palace,
1980.
3,000 square feet, 1985. And we had only kept it for the doctors only. Believe me, 2 years of my life I spent on it. I spent whatever money I had, went on collecting the material and what I had thought during that time. That was a period when India was showcasing outside India our art. So there was India abroad shows were there, and exhibition. So all those exhibitions were, and I thought it's a very easy thing, I go to Delhi and get the things. But unfortunately, during those times, those Nasbandi thing occurred. So
Yes.
nobody wanted to help as per the sex is concerned.
Okay.
I thought otherwise there are museum in Delhi and everything, and they will just give me, with an open hand. And then I started collecting all, studying about it. It was a very difficult task. Believe me, those 2 years, I was in a seventh heaven. Every day I used to find something, read something, and then the day came, you will not believe everything, as I said, 19 cubicles, right from the Brahma till the Britishers left, except tantric pictures which I had not kept it. Suddenly they came to know, journalists, that there is a such exhibition.
Oh wow. They would
They
have
said
flown
we
in.
would like to know. They said and we had only kept it for our own people,
Doctors, yeah.
those who were registered.
Yeah.
Because sex, to utter a sex word was difficult, and even we had prepared, that's still in my diary.
Yeah.
And what was that? Indian Penal Code, if somebody says ये बिभत्स है, हमारे लोगों को बहका रहा है, कल मुझे जेल में ले गए तो बेल करके कैसे छुड़ाना, वो तैयारी भी किया.
Oh.
And then I said, only on one ground I will allow you to see this exhibition. I will take you every 1 or 2 hours, conducted to. And then they were absolutely amazed. And John Money, one of the topmost world sexologists, after seeing that, he removed his gold ring, which was a phallic symbol, and gave it. And the best part was last day. Mulkraj Anandji came, who is a art genius as far as our country. And his first magazine came out, Mark, in 1946 when I was born.
Oh.
So last day he came, he started looking at each of these things, started writing them down. And I so आज तो मेरी छुट्टी हो जाएगी. Then he comes to me and then he says, Beta, if I have to die tomorrow, I am leaving my son on this earth.
Oh wow.
And for 2 days I was in a trance. There are 2 or 3 in my life incidents where occurred that I had gone on the trance.
Wow.
And then I came back. When I came back, I was doing a family practice. So nearly, I think 7 couples came to me within a short period. And 4 were my regular patients. And I said, how do they keep? I said, the best part was on the last day, there was only black and white TV. And there was a focus program. So Dr. Prakash Kothari, myself, Saroj Jha from WHO, and Dr. Clive Davis, we were asked to speak on sex education.
Wow.
And we were told not to use word penis,
Not to use vagina.
intercourse, and masturbation. And I don't know how I did
How
it.
do I do
Today,
that?
if you tell me, it's difficult. But that 1 hour program, because that was the only thing which was seen during those days. So when I came back, those 7 couples came. I said, suddenly, how the sex problem have come up? And I had no answer because there were no medications available during those days. Only thing people thought, give testosterone or some Ayurvedic silver pills which were being advertised that this will do. I have given 100 milligram testosterone, tomorrow 250, thinking that hormone has done to do something with that.
Right.
And in that particular era, when I asked those people, how do you come to me, why you suddenly realized? They said, we saw you on the TV because that was a program, was seen focus program. And then where to study? Nobody was ready to give even a small piece of information.
Yeah.
Those were the days, only black and white TV. That also 6 o'clock in the evening, by 11 o'clock it's over.
Yeah.
No medical testing. Thinking whether to be or not to be. And in that, the name is, Rishi Kumar Pandya. He was a head in the Canada, Montreal. He was teaching, hypnosis. So he had one communication art पे उसने ये रखा था 1.5 day workshop. And what I have learned in my life is from workshop and self studies.
Wow. Wow.
Honestly, medical colleges में कुछ पढ़ने को last bencher. And then that doctor, it was a 1.5 day program. So Saturday we went, and around the tea time, he who got married to Annapurna Devi, ex-wife of Pandit Ravi Shankar.
Pandit Ravi Shankar.
An amazing person. Recently he died. So at 4 o'clock, it was a mixed audience. He said one line, that tell next 5 years what you want to be.
Oh.
So I said, Likh dene do. I said, I will try to be a sexologist.
Wow.
15-20 log the, to and it was a mixed audience. He never knew who I am. Who has written this? So I have written, cut it off. He said, what is asking me to cut off? He said, cut it off, word try. say, I am going to be a sexologist.
Oh,
And that changed my life.
wow, wow.
And then next day, while going in the bus, I was thinking, what should be the name of my... See, abroad they use the word institution, Kama. So then I thought it should be ancient and the modern. So Kama, Institute of Sexual Studies. If you see, like WHO, it's a kiss. So
Wow.
once you hear, you will always... And
Lovely.
that's how I joined in the... And then
Lovely.
again, I went abroad. I did a workshop, and fortunately, all top people like Masters and Johnson, Hartman Pityan, John Bancroft, Lo Piccolo, Helen Kaplan. I did those workshops. Three things, I went to London and learned intracavernous penile injection for the first time. I was first to start that in India. Then I went to, the World Conference on Sexology at New York. And third, I went to Heidelberg, 8 World Congress. And that's all gave me a lot of information, this thing. And then I started practicing. But again, those were days where no medications were available.
Sir, so since the days there were no medications until now we have medications. How do you prefer to treat your patients? Is it only medications? What do you think works for them?
One must realize that, first of all, I take 2 sessions history taking.
Right.
And that's the most important part. And unless and until there is a rapport or there is a bridge or the trust which is developed, nobody is going to answer me correctly.
Yeah.
So, and what I do, not only a male, I said I want a female also. And if she can't come, I would like to talk to her over the phone.
Okay.
And that time I tell that your husband is out.
And what if the husband or the husband is not comfortable that I can't?
Zyadatar, they don't want to tell their wife that there is a problem, and
Yeah.
it is better to live with the problem than admit that I have a sex problem, because their whole self-esteem
Yeah.
in their sex act and finish.
Right.
And the women are most open. Male are hypocrites.
But then, sir, how do we treat those patients who
but-
say
but-
that
but-
they don't want to get their partner?
No, but then, I say I want to ask her 4 questions. And if you can go on and ask your wife and come back to me, I have no problem. See, so many times they don't want to tell that they are under medication. So many times they are not able to perform outside.
Yeah.
So many things are there. So always don't think it in one line, medical line. People who think medical, they fail.
Yes.
And I'll tell you, the urologist, unfortunately during those days, that was the only thing available.
Yeah.
I said, it's not a plumbing job.
Yeah.
It is a relationship, sambandha between those 2 people, and it's a sambodh. Unless you put all those things together, nothing is going to happen. So I have a very clear model which I have developed. Bio, psycho, social.
Okay.
Now biology is like diabetes, blood pressure, heart diseases, thyroid diseases, arthritis, old age, all those things comes on one line.
Yeah.
Then the hormones also, endocrine.
Yeah.
Then psycho. Need not be a mad people, but sleep disturbances, anxiety, depression, and there are plenty of myths and misconceptions people have got.
Yeah.
That is still a bread and butter, and because the sex education is not being given. And fortunately, I was in charge of SCCRT, not the secret. And that's why I was coming to Delhi again and again.
Wow.
We have a branch over there in Ramapuram or something like that. I forgot that. So I used to come, and Madam Thadani was there. She was in charge over there.
Acha. Yeah.
And I used to come very regularly. Now, SCCRT is sexuality, education, counseling, research, and training and therapy. So we had 44 branches and couple of projects. So I used to got across the India, right from the elite class to the smallest village, 60 kilometers away from Bhubaneswar, in a jungle I have gone and done. So that gave me a lot of strength
Wow.
over there, that particular
Yeah,
thing. So one is a bio, psycho part,
Yeah.
and the most important is
Social.
social part. See, we are still in a joint family.
Yeah.
एकता कपूर की सास की बीवी भी बहुत आज भी चल रही है.
हाँ.
And
Wow.
unfortunately, you may not like it. But maximum problem I have seen is in Muslims and Marwadis.
Ah.
And again in engineers.
हाँ.
Engineers thinks everything from the
Solution point.
solution point. No, yes, mechanical point of view.
Mechanical.
ये ऐसा ही होना चाहिए, वैसा ही होना चाहिए. In case of Marwadi, what has happened? The girls have educated themselves like anything. वो बंदा हार्डली बीकॉम किया और जाके, और इवन दैट ऑल्सो नॉट, अब मैट्रिक से वो अपनी फैक्ट्री 4 फैक्ट्री संभाल रहा है, 4000 लोग को. एंड देयर इज अ आइडिया डिफरेंस. My wife, she's a family physician. Her one of the, I won't name the caste, but Marwadi family is a very elite class. She was MBA, daughter-in-law. But मुझे बुखार आया है वो भी बोलने की छुट्टी नहीं थी. Mother-in-law also, I'll tell you what is happening to her. Now that's all. But now it is breaking. But these were the reality. So bio, psycho, and social. You put all those three things, and then once you find it out and what is required, those medication, you must find it out. One thing one must think is a diabetes. If somebody has erectile dysfunction, diabetes, or they are on the medication of blood pressure, or they have a heart problem, or they are on a psychiatric problem and medication of depression and other things. Now these are the people who needs your help.
Yeah.
And you'll be, many people we have caught that once they come with erectile dysfunction, don't try to treat with the medication.
Yes.
Because you are not seeing the holistic approach. As you see in the COVID part, people used to say only, metacin de diya, crocin de diya, paracetamol and khatam ba. No, it's not that. You have to find it out what organs and what systems has been affected. So unless, see, suppose if I have to give you a gift, I can give you like this. And the moment in Marwadis, I know they present it, put a nice ribbon and then they give, that makes a difference.
Yeah.
So it's a holistic approach. It is
Yeah.
not a just one another. And that's what I said, it's not a plumbing job. And most important part is not the sexual intercourse or what you do in the private for 5, 10, 15 minutes on Saturday night. It's how you behave with your partner all throughout the life and how much respect and love and caring you do. I think that is what is most important part.
Absolutely.
So coming back to again, bio, psycho and social. Now there are, one is education.
Yeah.
Lots of myths and misconception is there. How do you take care of it? So I use a Plicit model therapy. And if there is an anxiety, depression, I try to help them out.
Okay.
Along with that, if there are medical problems which needs to be first, take care of a medical problem.
Yeah.
Now, another catch comes in a psychiatric also. Most of the drugs, they've got a sexual side effect.
Exactly.
So it is a double-edged this thing. So you have to be very careful and try to treat them, all those things.
Right.
So there the counseling part comes in. And the last part is the therapy. Therapy mein fortunately, I was in charge of one of the sildenafil side treatments, Viagra ka ek brand jo hai. I don't want to name that, but I was in charge and under we did a multicentric trial of it, placebo control.
Okay.
And it's a wonderful drug.
Wow.
One thing it has done is it has made the subject very open. Now we can discuss about the sex jokingly in parties and other things, which was not happening.
Yes.
And it's a drug of the century.
Wow.
There are 4 drugs which has changed the mankind. One is the penicillin. Second came insulin. Third was the contraceptives which changed the reproduction and recreation.
Right.
And last but not least is the sildenafil side,
Self-nurture.
which has changed. So medications are there, intracavernosous injections are there, pumps are there which are not that useful. And what I do is sex therapy. Suppose if I want to learn the way in which he is, operating and making a film, is there any tablet which he gives me and I'll be able to do it?
No, you can't.
He will train me. ऐसे एंगल रखो, ये लाइट आनी चाहिए, इस तरह से बातें करो. Same thing with you.
Yes.
The way with comfort you make me comfortable. There's no tablet that you give and tomorrow onwards you can be a best, anchor or you will be able to interviewer. It requires a first, and that's why I always say, to be a sexologist, first of all, you have to be comfortable with your own sexuality.
That's true.
I have given talk in 300 girls, counselor female, and even the principal of the college was a female, Rupasha, and very comfortable. You'll be again shocked to know when I won't say that politician name, but in Chanakya Hotel in Patna, the inner wheel of Jamshedpur, Darbhanga, Sri Gayaji, and last but not least was a Patna at Patliputra. And 33 inner wheel women were there, and I was the only male talking to them for 3 days on sexuality. और लास्ट में 4 बजे चाय पी रहा था, एक लेडी आई और बोले डॉक्टर साहब आप आए हैं मगर बहुत देरी से आए, 20 साल देरी से आए, and that is still pinching me.
Oh.
And so one is a sex education, counseling, and last part is a therapy. As I said, plenty of. And I do a manu approach. See, you know your body much better. You
Yes.
know what is good for you.
Yes.
I cannot dictate you that you take this and you take. when we go to the hotel, and if a nice waiter is there, or the person who comes and takes your
Order.
menu card and other thing, if you ask them which is the best one, sir, आपको जो अच्छा लगेगा वही ठीक है.
Yeah.
Because the moment you say, and if it is according to him, but you may not like it.
Yes.
So these are the things, so it's a menu approach. And do not think that problems which are there for ages, that right from the childhood. And I just give you an example. There was one girl, she was married, not reaching an orgasm. She was hating the sex.
Okay.
And one of the meeting when I talked with her, and after developing that confidence, then I put both of them separate,
Yeah.
And the first thing I say, what you talk to me is going to be totally confidential. It will not go to anybody.
Right.
So she opened up, and what had happened during their engagement day, they were about to get married within a week or 10 days time. They went to a secluded, in Bombay we don't have a place like Delhi. Delhi you've got plenty of place for lovers to go and meet,
That's
So
true.
unfortunately over there, they went to Mahalakshmi in the rocks. Now those rocks are been removed.
Yeah.
And both of them went, and it was 7:30 getting late, She said, let's get up. Now, when you are meeting for the first time, the boy didn't wanted to leave her. He said, come on, better. And suddenly 4 people appeared.
Oh.
And they torn her clothes. They raped her in front of us. That trauma was there. And that once I talked, give a therapy, removed it. And after a week, she came and said, Dr. Saab, gazab ho gaya. I not only reach an orgasm, these are her words, puri chaddar bhigi ho gayi.
Oh.
So, so many things. Those childhood, again at the school level education.
Yeah.
And I say the parents are the best people who can educate their children.
That's true. Very true.
And imagine we are from the country of Kama Sutra,
Yeah.
who had given the world Kama Sutra, and really speaking, we were the pioneer. So we have put now, and I blame all the people who came with invaders. They gave their own sexuality, and that has come out.
Okay.
And the publishers were from Delhi, and very costly. And all boys hostel, they used to buy it. They were center sprayed and other things, and they will smuggle in, and then because 50 rupees during those days.
Yeah.
And for 11 years, I was a sex advisor to them.
Wow.
And many a time it happened in such a way. When I went to Bangladesh, somebody met me, and he was a president, a senior most person from Skin and BD department organization. And he said, sir, your debonair is the only, because I used to put sex advisor,
Yeah.
2 pages. And I used to see across the India, and not only that, what are the different types of problem, and those I used to answer.
Wow.
And he said, that's the only way of sex education to us. Please do not stop.
Very true. Very
And
true.
once I went to Kochi, in Kochi, my workshop got over. I said, let me prepone my. So I went to there, in a Indian Airlines was there, and I said, I want to go. They said, it's not possible. Somebody sitting over there in the corner, sir, aapke liye seat hai. I am your fan. I have been reading them.
Wow.
So that
So
is
great.
what has happened.
Sir, what message, won't take much of your time, what message would you give to people who are struggling with sexual dysfunctions and they've lost the hope that they can get better because of the treatments they've had with quacks, because of the over-the-counter medicines they've had, and they've tried everything. Now they've lost the hope. What is the message would you like to give to those
First of-
people? Focus on, sir.
First of all, the sexuality is an integral part of our life.
Right.
It gives us a quality of life. If somebody has a diabetes or blood pressure, he suffers or she suffers. Here, 2 people are suffering.
True.
And the benefit of sex are amazing. And there is no upper limit. Sex does not have an expiry date. I say, because even in sex, when you say the sex, they think that it's an intercourse. So I think first of all, we must start sex education, school and at home, most important, because again, there is a problem that who will give. And today, as I said, plenty of things are available. So one should not, and we use the word erectile dysfunction, but previously, a word for a male we used to use only impotency, female frigidity. They were both derogative.
Yeah.
And I say, in today's time, a man can be born impotent, but nobody should die impotent. So many things are there. And one of the most important part, There are medicines available, intracavernosus injection. I do beyond that, and that is called Masters and Johnson's sex therapy, which they used to ask the couple to come for 15 days. It was a resort sort of a thing. You are cut off from your home, cut off from your, what you call the office work. So you are totally concentrated like going to a temple. And then first day, male will take a male history, female will take a female history. Next day again the reverse. And third day they have a round table conference. So each one feels that there is somebody of my uh, gender who will represent me. And then by the time they examine and they do the investigation. And next 12 days, thrice a week, thrice a day, they have to come and they are being taught. And it's not the sexuality, but the sensuality is the most important. They gave a word sensitive focus. Now, when I started, sex education was available, counseling was available, some Ayurvedic product, two medical product. One was a yohimbina, and the second was a testosterone, as I said. But
Yeah.
today, I haven't taken testosterone in my hand for ages
Wow.
because it is not the thing. It's not an aphrodisiac thing. So this is the most important part. And here, as I said, I have converted that sunset focus because Masters and Johnson could not use the word sex. I have given a fine label of exercise. Now everybody is interested in a lifestyle change. They want to do diet, they want to do exercise, they want to do yoga, medication. So this is what I do. And advantage is there. They can be even online.
Yes.
Secondly, the first thing I say, what you talk to me is going to be confidential and the privacy. And third part, it depends upon, sometimes कोई period में आ गया है, कोई की शादी है, कोई की यहाँ कोई, baby shower है, those things. Unfortunately, today I see late age marriages are creating more problem. By that time, people become so strong mentally, they've learned how to live the life. The premarital sex, you will be shocked to know in a metro city has started even at the age, in the 9th and 10th standard. And and so many times they are not aware of even the condoms and the morning pills, they just
They
take it and they go ahead. And I see that our marriage institution is in a big problem. Tomorrow you'll see your whole society will be flooded with this. And sex has got many advantages. One is it creates a bonding, intimacy. Then it increases your self-esteem. You also have a good sleep. It's a part and parcel of life. You will feel that yes, मेरे में कोई कमी नहीं है, अभी भी मैं जमा हूँ.
Right.
And it also gives immunity increases. And last but not least, some of the research, at least few research that it stops the prostate cancer.
Oh yes.
So
I
these
think
are
the frequency of
so
ejaculation.
these are
is-
the messages. So I would say, if you have a sex problem, do not go to those TV channels. Do not read in the newspaper. Their monthly advertisement works in lakhs of rupees. Ask your family doctor. And unfortunately today, two things, another common I see. One is a Google guru giving lot of myths and misconception. And lot of women come out. They think what they have seen in a blue film in a porn, 15-minute sex. I said, Baba, when Amitabh Bachchan is fighting, he jumps from one roof to another. He
Can you-
hits two people here too. In reality, it can happen. They said, no. I said, then the same way, what they have shown is over a 6 months. And that may be, edited and kept there. And those people are kept because, like Amitabh Bachchan is a tall, or Salman Khan is a good body. So likewise, those who wear large organ or other thing, a big breastplate. So those are the things which are coming up. And unconsummation of marriage. You will be shocked to know, I had a couple, 22 years.
Of
They
marriage.
were moving one end to another, They had been to all possible. Lastly, he landed up with a cardiologist because he used to get anxiety.
Ah.
And the problem was, he was all the time, his father died. So he was caught between one side mother and one side wife. And then secondly, sex is inversely proportional to what you are earning. Higher you go, sex become less because they only meet at the airport. I am going, I have a meeting, I have a deadline and those things. How many times you are there?
Right.
So sex is the most beautiful thing. God has given such a beautiful gift to you. don't think from the angle of intercourse, which is much beyond the intercourse. And that's what our country has taught.
Wow. Thank you so much, sir. It was a beautiful
hope-
message. Thank you for all the education you've given to so many people across the ages, across the countries, across the borders. And I mean, I would say the humanity would be thankful to you all.
That's why, at this age, I run around. I want to create more and more Raj Brahmat all around.
Wow.
And the quackery should be stopped.
Absolutely.
And that is what we need to do.
Absolutely. Thank you so much, sir.
Thank you very much.